All right, joining me now is Carrie Bridges-Feliz, the Vice President of Community Health and Equity and the Director of the Lifespan Community Health Institute, to talk more about how important this Day of Giving is. Thank you so much for joining us.
Thank you for having me.
Let's talk about first the mission of the Lifespan Community Health Institute.
The simplest way to state it is that we're here to help all people thrive. I mean, we're really trying to help all people achieve their optimal state of health through healthy behaviors, healthy environments, and healthy relationships.
Yeah, I know a lot of what we talk about is, the care they receive at a hospital or facility. A lot of what affects that is what's else is going on in their lives,
yes.
Right?
Listen, hospitals are essential. We all want them to be there when we have an emergency or when we need hospital level care. But we also know that what really drives health outcomes mostly happens outside of healthcare four walls. Exactly. And so that's what happens in communities and in schools and in households. And so what the Community Health Institute is looking to do is to improve the conditions in which people live, learn, work, and play, to help all people really have the opportunity to live healthfully and to achieve their ideal state of well-being.
Yeah, tell us about some of the programs and services that people can get through Rhode Island Hospital.
Sure, so there's a range. Of course, because helping people achieve their optimal state of health is a big, broad mission. And so we try to organize ourselves against a public health framework. And that means that there's a certain amount of education and training, a lot of skill building programs. So food is medicine, teaching people how to prepare healthy meals on a budget. Programs for kids, teaching them safe sitter, how to care for others while being safe, and emergency response activities. We have programs we operate a training center for the Heart Association, a lot of CPR and first aid, and do a lot of public community-based education programs. But we also do a lot of work in partnership with other organizations to try to address those conditions that are driving health outcomes, to try to address housing and food security, help our patients get access to food services and programs, help our patients get access to housing. We screen at Rhode Island Hospital uniquely more than 2,000 patients a year.
Wow.
To address their social needs, things like housing insecurity, food insecurity. And then we connect, not just screen and say, good luck with that, but screen and connect them with an advocate who can help them address that need.
Yeah. So how will the generosity of all of our viewers out there who make donations for this directly impact the health of their fellow Rhode Islanders?
So it really goes back to that. It takes a village. We have to all be concerned with one another's well-being. I mean, we've certainly learned coming out of this pandemic that one person's health can affect others, right? And so we need to care about the health of populations. And so the giving through Day of Giving can help us extend these programs that really do address the whole person, to provide a complete state of health, to address holistic well-being, to allow us to do more of that social needs screening, to provide more adults and families with the emergency services that they need or the navigation support that they need, to deliver more programming in community settings, senior centers, schools, churches, faith-based institutions, to help bring the services that people want and the information that they want right to their doorstep.
Are there any specific activities or programs you'd like to add as we go into the future?
Yes, so we try to be nimble and we try to respond to the needs of the times. And we're actually doing a community health needs assessment right now. We've just begun in the Rhode Island Hospital service area. So we know that based on what we learn, we're prepared to adapt and flex, just as we did during COVID, to do COVID vaccinations and COVID testing. But we're looking forward to adding additional programs for adults to address, in particular, food security, because that's come up a lot. We are looking forward to partnering with some of the community farms and other organizations to be able to help some of our most insecure patients have access to healthy foods, more programming around how to prepare those healthy foods on a budget, and more programming out in community settings.
Great. Carrie Bridges-Feliz, thank you so much.
Thank you.